I'm just going to do the housekeeping before we go on to the agenda and the presentation. So if you could move on, please. So let me just introduce myself. First of all, I am Georgina Walton. I'm a Senior Project Manager within Adult Social Care, and I am delivering this project jointly with our many partners, and we will just recap on who they are on the front now later. So just to go through the housekeeping, if we can just move on, please, with the slide. Thank you. So can I just ask that you all please mute yourselves if you're not speaking. Cameras can be turned on or off depending on what works for you, but hopefully now you've muted your microphones and there's no more feedback on the system. Please ask your questions. There will be opportunities throughout the afternoon for you to ask your questions, either by popping your hand up and speaking to us, or popping your thoughts and questions into the chat function. We will be having breakout sessions today, and so the technical magic will put you into smaller virtual rooms where you'll then have detailed and facilitated conversations with colleagues. We are recording this session, so hopefully there's no issues with that, so that after the event we can share the slides along with the recording. I can move on, please. So the schedule for this afternoon. We will just recap on the Building Social Care Research Capacity Project and the aims and objectives. And I will introduce you to my colleagues and partners that are involved in this project. We will then share with you identified research priorities. You'll go into breakout sessions where you'll start to discuss those in more detail and rank those priorities. There will be a chance for a break later on. We will then talk about communities of practice. There'll be another facilitated breakout session, and then we'll all come back together, have a wrap up, question and answers, and agree on the next steps. And it's lovely to see so many of you here. This is just a disclaimer from the funder, because this project we have received funding from the National Institute for Health Research, so we have to include that note there. So just to recap on this project, for those of you that were not part of the July event where we went through into a little bit more detail, but also just to refresh your memories as to what this project is all about and the aims and objectives. So there are 6 partnerships funded across the country, and Kent is one of those, to explore, develop ways to ensure that we can build social care research capacity and how we make that sustainable. The aims of the research partnerships are to build long-term collaborations between partners, and there are a number of partners involved in this. And very importantly, the relationship with the care sector as well as our social care workforce. Co-production is absolutely key, so working with people in Kent that receive social care and carers to ensure that we're looking at the right research priorities and developing the project together. Providing context and mechanisms for capacity building, so we're looking at how we can develop communities of practice, embedding researchers within social care organisations. And our aim is really to embed a research culture within Kent that is sustainable and that works for us and our partners, and that we will share our learning not only locally but nationally with the other partnerships and with other organisations. Can move on. So we have lots of people involved from lots of different organisations. University of Kent, we have staff from adult social care, we have the care sector as part of this this team. John Potts, who is our public and engagement lay representative, and he leads the working group, and he'll be helping us today facilitate some conversations. And we have a representation from the University of Kent in various roles. And we are also supported by the ARC, so that's the Applied Research Collaborative, Home Care Association, and so that the care sector's got a really key role within this project. So there's also the Kent Integrated Care Alliance from Kent, and Becky Dilly from the Clinical Research Network. So we're supported. We've got a really good partnership in Kent to help design and implement this project. And I'm now going to hand over to Anne-Marie. And I'm really sorry, Anne-Marie, we completely took the wrong approach and we agreed we'd done it the other way around. But anyway, I'm going to hand over to you now.
It's all right. It's not a problem. I was sitting back having a nice relax. So thanks, Gina. Okay, so I'm not going to spend too much time on this because some of you would have heard it before, and also there's going to be some more detailed presentations as we go through the session this morning, or this afternoon, I should say. So essentially, this is a 4-year programme of work. And it is divided broadly into 4 different work streams. So one of the work stream 1, which is the one that we're really going to be focusing on in our sessions today, is around communities of practice, and Sweta will be giving you a detailed presentation on that later, so I'm not going to say much more about that. Work stream 2 we called Researcher in Residence, and you will have seen that Raza and Wenjing from the University of Kent are with us today. If you've got gallery view, you might see them waving. They're doing they've done a lot of the organisation and preparation for today. They are very experienced researchers, work with me at the University of Kent, but they also have a really strong practitioner focus, and as such they're ideal for this role. So the idea behind the Researcher in Residence role is really that you take 2 different angles. One is that you take qualified researchers and you embed them into practice. So you embed them into social care organisations and help them support and maintain links and try and really grow research from the grassroots. So they're very much there to support you. And I'm sure many of you here today will have already had a chance to meet them because they started in October on this particular project. But also Gina's been advertising for a Researcher in Residence role that will be employed by KCC, and that the applications have closed now for that role, but this will be a practitioner who wants to embed themselves in research, and they'll have great opportunities. They'll be employed by KCC, but they will be able to work within the University of Kent, and they will have a kind of honorary position with us so that they can really embed within that research culture. It's a really nice opportunity. And this is something that's been used a lot in health, this Researcher in Residence model, but less so in social care. So it's quite innovative, and it's something we will be evaluating as we go through the 4-year programme of work. Work stream 3 doesn't actually start until month 18, but just to flag that within our communities of practice that we will be developing over the next sort of 6 months, there will be opportunities from people within those communities of practice to apply for research and training fellowships. These are really exciting opportunities because they will actually fund people's time to take part in research, and that includes backfill for your post, and that's not just open to KCC staff, that's also open to provider staff from the external workforce. So if you work in a care home, you work for a home care agency, then you are also eligible to apply for one of these fellowships. And finally, work stream 4 is around dissemination and impacts, and I think that's pretty self-explanatory. It's about getting our findings out there in a way that's accessible and really helps people find out what we're doing and learn from the study. Okay, so enough from us. I'm now going to hand over to Liz Jones, who is Policy Director at the National Care Forum, one of our key sector partners in this research. So over to you, Liz.
Thank you very much, Anne-Marie, and thanks everybody for coming along today. I think this is a really good turnout. Anne-Marie and the team just asked me to say a few words really about our perspective from the National Care Forum on the importance of research in social care. And so I just wanted to talk to you a little bit about what we think about it really, and why we're so pleased to be partners in this particular project. So if you move on to the next slide, please. You're probably wondering, who am I and why am I talking to you? So we're part of the research team alongside our colleagues at the Home Care Association, and obviously colleagues locally in Kent. The National Care Forum is a membership organisation for not-for-profit care and support providers. So we've got members all over the country, England, some in Wales, some in Scotland, some in Northern Ireland, mostly England, and they provide all sorts of different types of services, both registered and non-registered services. And they support nearly 200,000 people. They operate nearly 7,500 services, and they employ, I don't think you can see it at the bottom, but they employ over 100,000 staff. And our members really are I guess, our real connection to the front line. So I just wanted to acknowledge really that, you know, now probably more than any time really over the last couple of years is a really difficult time to encourage the sector to get involved in research. And I just do want to take a few minutes to reflect on how difficult the last 18 months or so have been. And certainly from our perspective, how amazing the response has been from those working in the sector, trying to offer really good care and support over what has been really pretty unprecedented times. On this slide, you'll see a kind of whole mix of the experience that people went through since February, March 2020. And I guess, you know, it's worth noting that we're back in times of uncertainty with the new variant Omicron, you know, potentially bringing more uncertainty to us. And what we have seen throughout have been the dedication and resilience of your workforce, trying to work alongside the people that they're providing care and support for and their families. And there's a kind of snapshot of some of the different things that we were working on about raising awareness of the impact that COVID was having really early on in the sector, trying to support meaningful visiting in the sector, and thinking about celebrating some of the amazing work that happened during COVID that really didn't get reported on. But I guess it's to say to you, we all know, we really do understand that the pressures are very real. I think from our perspective at the National Care Forum, we've been campaigning on the fact that the workforce pressures have been ramping up since the summer. And we're now in the remarkable but happy position to find our colleagues across the sector, be that the Association of Directors of Adult Social Services, be that NHS providers, be that local government association, or Unison, you know, one of the biggest unions in social care. Everybody is calling on the government to recognise those workforce pressures and to do some very practical things to support the workforce. And if you the next couple of slides just show, you know, that the data is following the data that the government has been accepting about the pressures in the workforce in the sector has been following what we've been saying from our members, really. So the Skills for Care data was showing a big pressure in the workforce, and the CQC data, which is on the next slide, in their State of Care report, was also echoing the importance of really starting to do something about the pressures that the sector is under. So we understand that this is not an easy thing to do, to take some time out and to be involved in innovative research programs. But I wanted to take a few minutes to reflect, really, what is it that we as a sector, both those working in social care and those people using social care either now or in the future, you know, what is it that we actually want from research? And we've got a bit of a vision at the National Care Forum about what we want, and that shapes the partnerships we're prepared to get involved in and the partnerships we're prepared to bring active support to. So we think there is a lot of research that happens in health and social care, and actually some of it is more useful than others. So we think that research projects and programs should really put the sector at the centre of shaping research priorities around what's really important to people. And that's people now, and that's people in the future, and that's people who are using care and support or may need to, and that's people working in the sector. We think that there is much more space for the kind of creative and mutually beneficial relationships that this particular project offers. So it's about really a shared trust, a shared respect, a shared collaboration between people working in the sector and people using services and the research community, who can bring their expertise and wisdom to help us, particularly help us strengthen the evidence base about what should underpin really good quality care. What should we think about what should we think about in terms of new ways of doing things, new models of care, responding to emerging needs, recognizing unmet needs. And of course, within all of that is really understanding that if people in the care sector are to be able to participate and fully engage in active research, then quite frankly, they need some resource in the same way that our academic colleagues do. You know, people's time is incredibly valuable, and particularly in a sector like the care sector, where there's not very much money really sloshing about to support this sort of stuff. Research projects that come with some money and some opportunity to really bring the active participation of the sector into that research process, it is part of that vision. So we're thinking research with the sector, for the sector, by the sector, and actively supported to take part. So yeah, next slide please. So I guess reflecting on all of those principles and those pressures, I just really wanted to remind you, because I had to remind myself last week about this, is what have we got here in this partnership arrangement that is actually being funded and invested in by the National Institute of Health Research. I mean, for probably for the first time that I can remember, for quite a while, possibly ever, there is actually an investment specifically into social care research in this area, and it's funding 4 years worth of focus to explore the topics that can inform the social care research that will make the most difference to all of you. So this is direct investment, which will help to produce research that's shaped by you, because you're leading the priorities. It's done with you, not to you, done collaboratively, working across the sector and across different types of services, working with people who are delivering services and people who are receiving services. And it's funded. So this is a really brilliant opportunity to build some of that research capacity in our sector, and start to create that really positive research culture with the help of people who are really good at it, and informed by the sorts of things that are really important to us and to you as a sector. So Anne-Marie mentioned the fellowship projects. So that's 3 fellowship projects, each of which, I think I'm right, there's £100,000 available for each one.
£90,000, yeah.
£90,000 available to fund. So that's 3 lots of £90,000. So £90,000 for each research fellowship, to offer the opportunity for people working in the sector to develop their own research skills and expertise on behalf of the sector and for the benefit of the sector. And that will also help to shape 2 or 3 communities of practice, which is basically a researchy way of saying a group of people interested in a particular research topic or idea, where they get together and put forward the opportunity to try out some new ideas, some new ways of working, which in effect will be a kind of trial, a pilot type approach, and to see, you know, where what difference some of those theories of change, those theories of shaping evidence-based practice, what difference do they make, and do they help us in in ways that we could predict and in ways we couldn't predict, to shape our practice, inform policy, potentially give feedback to our policymakers and our commissioners, particularly in the world that we're going to be moving into of integrated care systems. And alongside this, there's a programme around training and events to really help engage our workforce in research activities and research practice. And so I know it's a really tough time. I really do. I really understand that. And I know it feels that sometimes perhaps research is the thing that it's really hard to get to on the list because there are so many other pressing priorities. But certainly some of the things that we've found when we have been actively involved in research that we have driven, we have wanted to shape, and we've been able to take part in, is that we've got some invaluable insight into how we can improve the practice that's available, what some of that research means, why is it that we have got that insight at the front line, but often it's very difficult to translate that up to policy making? Well, partly it's because we haven't got the research sitting behind it, which other sectors have. So I just wanted to really recognise how difficult it has been for lots of the people on this call, how valued you are as people with an interest in this project and partnership. It's got a few years to run, so there is all to play for, and why it's so brilliant that you're part of it, and that the team here are really keen to make sure that you're able to take as much active participation in it as you can, and really make it work for you. Back to the research with the sector, for the sector, by the sector, the priorities that you think are most important in your area to have this research capacity and this positive culture of funded research. Thank you.
Thank you, Liz.
Thank you. Sorry, Renjing. I was going to introduce you. Yeah, thank you, Liz. That was really good, and I think it's so helpful for us to hear the views of the sector, and for you to speak today. It will hopefully give people confidence that we are listening, and we do recognise it's really important. So I'm going to hand over now to our researchers in residence, Wenjing and Raza, who are going to take you through some feedback from the first event and some of the researcher priorities that you all helped us identify.
Thank you, Anne-Marie. As Liz said, this project, we really want to hear from you all who are working in the sector or living with using the services or supporting your families and friends. So from our previous event, as Jana mentioned earlier, which was held in July, some of you attended there. And from that event, we asked all the participants to discuss what do you think are the key priorities in adult social care in Kent. If you remember, we ran a very quick analysis on the day based on the notes from each discussion group. And here are the key words or key terms being highlighted by all different participants, and which was echoed in different groups about support being needed, about the importance of service, and the importance of all different areas like workforce and others. So following that, during the last few months, Raza and I had done some more informal analysis based on the notes from your discussion groups, where we try to categorize and group them into different topics, and to make them more logical. Firstly, we acknowledge that all these topics, or the majority of them, are interlinked. So they are not in the single way to be grouped. We are mapping them in this way to make it as systematic as we can. But please feel free to send your feedback to us, and we will have discussions upon this in a short time. So we group them in 4 key topics and trying to cover all the bits from noted down by different participants in that previous event, and I'll hand over to Rasa to explain what are the key points we come up with as these 4 sectors.
Thank you, Wenjing. I hope everyone can hear me okay. I trust Wenjing will shout if you can't. But after all that work of grouping those interrelated themes, what we came up with were 4 broad priority areas for adult social care research in Kent, again, based on what people at the previous event have said. So it's not us at the, as in the Kent Research Partnership team who are kind of controlling the narrative or guiding where we go, but it's very much based on what you said to us the previous time. So just to present the themes in a tiny bit more detail, they're not in any particular order as displayed. But one of the themes that came out quite strongly was empowering under-researched groups. So really focusing on inequalities and accessibility and focusing on seldom heard groups in research. So partly what came up, or the groups that were discussed, were older people living with autism, people who receive social care service input and self-neglect, people with complex comorbidities, in particular kind of mental health and physical health intersecting, just to name a few. Another priority area that came out of our grouping work is around effective interprofessional working. And this really covers anything across the scale of interprofessional working, from working across sectors and bringing together public, private and voluntary sectors in adult social care and kind of enhancing collaboration opportunities, to working across organizations, kind of better links between social care and healthcare, to really kind of team level, multidisciplinary working. So looking at all those elements. Another area that came out quite strongly as well is one of co-production in social care services. So acknowledging the need both to listen to the voices of people supported by adult social care and their unpaid or family carers, and also involving people actively in co-designing services, in designing care pathways or how support is provided to them in a sort of nothing about us without us way. And the last theme that came up, and given what Liz has spoken about, it would have been so surprising if it didn't, is one of enhancing workforce sustainability. So very much looking at recruitment and retention in adult social care and how to support this during quite unprecedented times of workforce crisis. Looking at career pathways and how to enhance those, especially for frontline care workers, but not only that group, as well as education, training staff, well-being. So quite a lot of things fit within these broader categories. And we kind of felt that they captured well the richness of all that you told us in the previous event. And as Wenjing has already kind of preempted, what we'd like to do next is see you comment on these priority areas and say, is something missing? Have we got something right or wrong, etc. But I'll hand over back to Wenjing for the next part. Thank you,
Rasa. I'll bring back to the previous slides as I noticed some audience would like to see it. Actually, after hearing what Rasa explained about each themes or each topic we've identified, I hope this figure also makes more sense to you about these are our kind of first level 4 priority areas. And these are the notes we got or summarized from the notes from previous meeting. Some examples Rasa also mentioned about. We will share the slides with you after the event. And also if you have any questions, please feel free to use the chat box. If we have no time to respond to you, we will also circulate the Q&A after the event. So as we are now going to move on to the discussion to listen to your voice again. And for this session, we would like to hear about what do you think of these identified research priorities, these 4 themes do they make sense to you? And among these priorities, which could be of regional and national importance and impact? And also we want to know that what Kent could lead on these research priorities, as well as the last one is what are the most urgent to address. So based on your group discussions, we would like to know your individual response to the how to rank these priorities. So these are the 4 priorities. Which of these themes are of highest priority in your view? And are there any priority areas or themes being missing? So we set up a very brief survey. So I'll hand over to Rasa to talk over this.
Thank you, Wenjing. So what we've done so far is we've taken a really quick exercise of seeing how the priorities stack up from your responses. At the point when I kind of cut it off about 5 minutes ago, just to be able to display this information on the slide for you, 52 people have filled it in. So nearly everyone who's not a facilitator in the group has been able to fill in the priority exercise. Thank you so much for your time doing that. And I guess just a little bit of feedback for what we've done. So we averaged out your ratings. And although, let's say, for enhancing workforce sustainability, some of you rated it as number 1, some of you may have rated it as number 4 in terms of priorities. But we averaged it out. And it looks like by quite a margin, enhancing workforce sustainability is the winning priority, or that the majority of you have ranked it really highly. And then co-production in social care services and empowering under-researched groups is coming really close. As you can see, there's like a tiny margin of difference between 2nd and 3rd place. And then coming last by a little bit less of kind of priority setting rating is effective interprofessional working, which is really interesting for us to see and really interesting to feed back to you. But just as I kind of hinted at earlier, we will do more to look into this. So there may be a handful of you who still express their priorities or complete the survey in the coming minutes. Please feel free to do so if you haven't yet. And then we'll have a look, well, are some of these priorities, you know, consistently scoring high, or are some of them Marmite? So let's say for co-production, are some people scoring it as number 1 and others as number 4 and very little in the middle? And we'll also see how people from different stakeholder groups, be they people supported by services, their informal carers, service providers, commissioners, if there's any among you, you know, how different groups score and if there's any divergence from that. But this is just a very quick glance at how it's kind of stacking up. So thank you very much. In conjunction to the notes from and recorded segments from the breakout rooms, this will really help us figure out what's a priority for Kent. So thank you for listening.
Thank you, Rasa, and thank you, everyone. So we will move on to the next section. Why we need these priorities? We would like to build some community of practice based on it. It's the ranking doesn't mean the bottom 1 or the bottom 2 will be removed. We will think about the way how to merge them, how to collaborate between these ones. I'll hand over to our work package lead, Sweta, to talk about what community of practice is.
Lovely, thanks so much. It's such an honor really to be here and have this discussion with all of you. Without further ado, communities of practice, what does it mean? And you might or might not have come across this in your professional practice or in your daily work. It's very interesting. A community of practice is actually seen as a group of diverse individuals. Yeah, it could be service users, carers, practitioners, OTs, multidisciplinary team members, etc., who are all participating in a communal activity that has a shared goal. And here the goal is, of course, improving adult social care, research capacity, and having an impact on practice. The length and duration of a community of practice is completely variable. It could be a targeted piece of work. It could be something that lasts for a long time. And through the sharing that happens in this community of practice, we develop shared identities. So this is, so I know it sounds quite broad and sort of, umbrella term, but it is very useful because it is both the methodology by which we will create research priorities and then act on them. It is also the group that you will draw on for knowledge exchange, for example. So some of the key things that we want to talk about in relation to a community of practice is thinking together. So the greatest asset we have is you. Your ability to share your experience, your intuitive thinking about what would improve adult social care is exactly what we need. We need people to share this with each other. In the breakout room I was in very recently, we were talking about the fact that at the moment, adult social care practitioners don't even really know what's happening with, in Kent, because there's so much happening in Kent and they're not really fully aware. So there's knowledge gaps that we need to bridge as well. One thing about thinking together is coming up with a heterogeneous idea of what older people are and what they need. We do not want to assume what is best for older people. We want to, and certainly for adults with learning disabilities and the whole range of services we provide. So we need diverse ways of thinking to work with diverse groups of people and not homogenize what that possibly is. And so here I want to talk particularly about two things. One is an intuitive way in which we understand what people need. And of course, they have a more analytical, evaluation-based approach towards arriving at the same goal. So sharing diverse ways of thinking is absolutely crucial to this community of practice. We've talked a lot about capacity, and I think that came up in our group, didn't it? I was with Marianne and John and others. And the notion of capacity is really crucial. It doesn't just mean capacity for practitioners. It's also physical capacity, as John mentioned, for carers, for older people themselves, for adults themselves. So how can we develop capacity? And as Liz had so beautifully put it earlier, make space to not just survive, but also think about innovative ways in which research can help improve the lives of people. And that's the absolutely crucial part. So it has to be relevant, it has to be impactful, and it has to be meaningful across the sector. One thing that's very important for me, certainly as someone who is a trained social worker, is this notion of professional confidence. We want to develop professional confidence for everybody in the adult social care sector, be they social workers or not, whether they're NQSWs or right up to senior managers, in saying they're confident users of research, they direct research-led questions, and they're able to design interventions that are informed by bespoke research. And that requires some amount of training and knowledge exchange. And so we certainly, I think we have the easier part of the bargain. We learn so much from you, but we can provide targeted specific kinds of training to enable you to get those research skills. Next slide, please. So just to explain where we are, we're kind of in this between stage 1 and stage 2. In the first stage, we try to set up research priorities or a way of bringing together some common ideas of what matters, if you like. Stage 2, which is developing the communities of practice, is a more complex task, because we have to take these broad ideas like co-production or empowerment and convert them into something practical that we can work on. Once we develop communities of practice, and mind you, they might expand or they might give birth to other babies. So there are lots of little mini communities of practice, or they might just collapse and two big communities of practice join up together. So it's this whole kind of really organic process of figuring out what we have in common, what's distinctive. And certainly from the breakout room I was part of, there's a couple of things we didn't think about, which is really interesting in terms of our priorities. There were new things coming up that we hadn't thought about, which is really useful. The third stage is capacity building, where we'll be working on training, facilitating specific workshops, matching researchers and practitioners and providers on particular topics. And then we look a lot at sustainable practice. The key thing with the communities of practice is that we don't want to set up something that falls apart once the academics pull out at the end of the grant. We want something that is actually beneficial for you and that will either bubble under the surface as a minor part of your very busy lives, or completely energize you and become a community of practice that we fund. So it has to be sustainable, it has to be meaningful, and also flexible, so that the needs and interests that you have in this group continue. We will, of course, be evaluating these communities of practice to see whether they generated, from our point of view, research confidence, whether they've created new ways of thinking and new kinds of specialist knowledge that you gain through it, and also, of course, evaluating innovative practices and legacy planning in terms of what happens next. So if you like, we are sort of in this gray space between stage 1 and 2. We are beginning to think about communities of practice. What might it look like? What kind of things might come under it? And this is the messy part. What happens when two communities of practice really overlap? How do you belong to both? And yes, of course, you should and can belong to many of them, so that's not a problem. But it's trying to develop a very clear idea of what your shared interest is. Next slide, please. So where are we now? We already know where we are, so I'm not going to spend much time here. We've done the research priority ranking, which is really important. And what we're going to do now in the second breakout room is turning these research priorities, which each of us have said we think is more important in different ways, into communities of practice. Before we move on, and I hand over to my colleague Farhana, I wanted to perhaps give you an idea of what a community of practice might look like, because it sounds very vague, very abstract, doesn't it? Let's say there's a whole group of people who are extremely interested in older people and autism. This is something that is under-researched, and very often it creates problems with diagnosis later because they have not been assessed as children, they have not been supported early on in life. Many of them have found ways of coping that mask it, and these kind of issues can come up. Now, let's say we have this sort of what we call it, critical mass. Suddenly, everybody, there's lots of people who are interested in this one thing. We might be able to develop a set of questions to help inform this particular community of practice and develop it even further, right? So it's a shared goal that is achievable, pragmatic, feasible, and can actually create a set of steps and action points that can help us provide more information to you, if that makes sense. So I hope that gets you thinking. I will pass on now to Farhana, who will tell us what we'll discuss in the breakout rooms. Farhana.
Hello, everyone. So before we are taken into our other breakout rooms, so it would be helpful to get your responses around, what Sweta said, how we can translate these research interests that have been identified through these research priorities into a community of practice. And then what would really encourage and help you to be involved in this community of practice? Is it us leading it, which I suspect isn't going to get sufficient, interest, or how we can work with you to generate that interest and to, work together to get the research priorities really embedded and to generate new research ideas. So it would be helpful to discuss that further in our next session. And I believe that we're going to be broken out into our rooms again.
So thank you all very much and welcome back. So really interesting discussions. We haven't got time to go into the detail of the breakout discussions because we probably need another afternoon to do that and look at what the key points are. But what will be happening now is that our colleagues will pull together all the notes from the breakout sessions and probably theme some of those so that we can then share that back with you all, so you can see not only the reflection from your discussion but also from the other discussions and look at the key themes. But thank you all so very much for your time this afternoon. Really great. Well, certainly in my breakout session, it was a really good discussion and a lot for us to think about. And thank you so much for all of the speakers today, Raza and Wenjing for leading on the emerging priorities. Really interesting. So what we'll do after today is we'll send the recording from the session along with the slides and also a summary from each of the breakout sessions, which will then start to inform the communities of practice. And it's when we start to do that, we'll then share with you information about those so that you can engage with that, because it's really important that you have the opportunity to engage with those communities in practice, particularly the ones that you're interested in, and that we will then have a follow-up event next year. Anne-Marie.
Yeah, sorry, just finding my unmute. Yeah, that's great, Gina. Thank you. I just wanted to echo what Gina said. I think we can't do this without you. And I found my group's conversations incredibly helpful. I mean, I suppose we've got a few minutes left, and if anybody has any comments they would like to make at this stage, or if you would like to ask a question. I know we're now in a very large group, but this is your opportunity to have a final word, if you like, before we close the session. So please feel free to either raise your hand or pop a question in the chat now if you would like an immediate response. Otherwise, as Gina said, we will have the opportunity to feedback and get through all those questions in the chat gradually. I can see John's got his hands up. John.
Yes, very briefly, we have the working group established, but if there's any of the members here today who'd like to come and join us, please feel free to drop an email to, probably easier, to Gina. And Gina, can you just put that in the chat, please?
I will do, John. Great. Thank you for reminding us.
So that's just to clarify for those of you that haven't met John and weren't at our first session. John and Gina run a public involvement and engagement working group for this project. So if you are a person using services or an informal carer, this is the opportunity for you to get involved. And so this is a really nice group, and the working group will contribute to all aspects of this programme of work over the next 4 years, including being supported to take part in the communities of practice when we establish them. So although a lot of what we've said today is around workforce, understandably, because that's where we're coming from this perspective about embedding research in the workforce, it's absolutely essential that we have the voices of people using services and those who provide that essential informal care. So if you're somebody who can really resonate with that and would like to be involved, as John said, do get in contact with Gina and we'll talk to you about the potential to sign up to that working group. Thanks, John. Brilliant point. I can see a couple of other raised hands, but I can't see who it is on my screen.
Sweater.
Sweater.
Sweater, you're muted.
Somebody else had their hand up as well. I'm happy to wait if that's helpful.
I'm only limited to who I can see.
Shall I just briefly? Yeah, go ahead.
No, I can only see your hand up.
All right. Shall I briefly just share what came up in our group that was really important? It's the need to change the organizational cultures around these practices, which can be really hard work. And I think they're right to point that out. It's a much more, that's what's going to create sustainable change. So I think there's a real hunger and appetite to find buy-in from senior, people in the team in terms of their work, where they work, and just make sure that the changes we want don't end up just as ideas, but they get translated to a better working environment for staff.
Excellent. Thank you, Sveta. Okay. Raza and Wenjing, can I hand back to you just for a final close? If there's any reminders that you've got for everybody?
Thank you, Anne-Marie. We have no reminders, just to inform everyone that if you haven't filled the online survey, please do so. We put the link in the chat box. We will also send a follow-up email to you with the slides available and some responses to your questions in the chat box. If you'd like more information or get involved in this project, please contact us, and our email is kentresearchpartnership@kent.ac.uk, which is also in the chat box.
I'd just like very quickly to interrupt and say, John, you've got your hand up, and I'm wondering if that's from before or you've got a new point or a question perhaps.
No, my fault, sorry.
Not to worry at all, just didn't want to assume. So thank you very much, everyone who have been able to join us today, and for the discussions and contributions that you've made. I think that's it in terms of kind of housekeeping and close. So perhaps we'll hand back to Anne-Marie and Gina, who started, to just say the final farewell. And to say watch the space, because there will be new events and there will be new opportunities, many of which Anne-Marie and Gina have talked about at the beginning of the meeting.
Yeah, no, thank you very much. And just to say, we want to keep this conversation going and engagement going. So we will keep you all informed as and when there are opportunities for you to get involved, because this isn't just about us talking, this is about action and taking the outputs from today and moving them forward. So we'll keep you all informed so you can continue to be involved. So thank you all very much for your time, and see you all soon.
Thanks, everyone.
Bye.
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 Thanks, everyone.